Hi everyone, my name is Amy Schroffstetter. I'm with Walsh Duffield Companies. We are the insurance broker who has worked with Katie to put together your group benefits offering for the January 1st, 2023 plan year. This presentation will go through the benefits that you should evaluate during this open enrollment period. These benefits are also available to any new employees joining Rochester 100 during the plan year or existing employees that may have a life event, allowing you to enroll in the group benefits during the plan year. The presentation today will go over all of the group benefits offered by your employer, Rochester 100. This includes medical health insurance and dental health insurance offered through Excellus. In addition, we're going to talk about health savings accounts and how they can be valuable to you. There is also a Medicare group plan for any retiree of Rochester 100 who has reached the age of 65. Finally, we will talk about enrollment details and reminders, which really pertains to those folks who are in the open enrollment season right now, just to make sure your enrollment information is captured in a timely manner and processed correctly. As mentioned earlier, the elections you make during the open enrollment period will become effective January 1st of 2023. Rochester 100 does offer you and your eligible family members a very comprehensive benefits program. So we currently encourage you to take some time to review all the information in this presentation and make those good decisions for the well-being of you and your family. The coverage that is elected during the open enrollment period is locked in for one full plan year. Unless you have a qualifying life event, such as a recent loss of coverage, potentially maybe through a spouse, you've gotten married, you've had a birth of a child, those are considered life events in which you will be able to enroll in group benefits with Rochester 100 because of this special election period. It is very important for you to remember that the enrollment must be received within 30 days of the life event. Otherwise, you will not be eligible to take advantage of that special election window. Therefore, you must need to wait until the following open enrollment period. So we're going to begin the presentation with the medical insurance that is offered through Excellus. Before we get into too many details, of the coverage, we are going to make sure you all understand that Excellus really is giving you freedom and protection of the largest network in the world. So when you carry that blue card, not only are you getting a very high participation rate locally, as you can see, there's 100% hospital participation in your region, as well as 99% of the providers do accept the Excellus card. These plans are PPOs, which basically mean in addition to receiving care locally in your area, it does give you the freedom and flexibility to seek care outside of your region. As you can see, nationally, there are 1.7 million providers who accept Excellus, as well as 96% of the hospitals nationwide. The national coverage is driven through their Blue Card program. Basically, all of the blue plans nationally, they talk to each other. So if you are in another area, say Cleveland, Ohio at the Cleveland Clinic, that blue plan would very easily be able to speak with Excellus in Rochester to process your claim. Having this coverage and carrying a blue card is certainly a wonderful benefit of your medical insurance. In terms of the specific plans offered, the two plans that are currently offered by your employer, the Signature Copay 125 and the Signature Copay 130, will remain for 2023. In addition, there will be one new plan offered called the Signature Deductible 3. This is a new high deductible health plan. For those of you that are currently enrolled in the copay 125 or the copay 130, there is only one significant benefit change for the 2023 plan year that we wanted to point out. That benefit pertains to the telehealth benefit. Currently, those telehealth visits with both a primary care provider and a specialist are covered in full. Moving into 2023, you will now have a copay for those telehealth visits. On the signature copay 25, the PCP copay is $25. The specialist copay is $40. On the signature copay 30, your PCP telehealth copay will be $30. The specialist will be $50. The first plan offered by Rochester 100 is the signature copay 125. This is your traditional copay plan with the lowest copays available to you and your family. As you can see, there is no deductible, which means there is no initial out-of-pocket expense to you. Your primary care visit is a $25 copay. Your specialist is $40. Your labs are covered in full, and your x-rays are an additional $40 copay. In addition, the inpatient hospital copay is a $250 fee. The outpatient surgery facility is $150. If you do visit an emergency room, it's $100. If you visit an urgent care, it's $40. In terms of prescription drugs, one very nice benefit on this plan is the low copays for your prescription medications. Tier 1 is $10, Tier 2 is $25, and Tier 3 is $40. If you do fill your prescriptions through mail order, you get a reduction. Instead of paying 3 copays, you will pay 2 copays for a 3-month supply. We'll get into a little bit more detail about mail order in a moment. Additional benefits we like to include are physical therapy, occupational and speech therapy, which is a $40 copay. If you do have diabetic supplies and equipment, it's a $25 copay. Durable medical equipment, wheelchairs, compression stockings, it's a 20% coinsurance, and your routine eye exam is going to be a $40 copay. We do include out-of-network benefits as well. Just be mindful, especially since we just spoke about the expansive Excellus network. It's very rare for you to be out of network when you carry the Excellus card. As you can see, most of those fees go to a co-insurance, which is a percentage at 20%. Again, unlikely, I should say, that you would be out of network with this Excellus plan, but we do like to include those fees for you. Okay, the second plan is the signature copay 130. It's very similar to the plan we just discussed, but as you can see, the copays on this plan are going to be just a little bit higher. It still does not have a deductible, so it is a traditional copay plan. Your primary care doctor is a $30 copay, your specialist is $50. Your labs are continued to be covered in full, and your x-rays are $50. So as you can see, the copays are just a little bit higher than that copay 25 plan. If you are admitted to a hospital, it's a $750 copay. If you do have an outpatient surgery, it's $250. Your emergency room visit is $150. Your urgent care is $50. One thing to point out on this plan, you can see the difference in the prescription drugs. These prescription drugs are covered at a co-insurance or a percentage. So I would be mindful to make sure that you do verify what prescriptions you have. 40% of a prescription can be very expensive depending on what prescription it is, but you can see that all 3 tiers, Tier 1, Tier 2, and Tier 3 have a 40% coinsurance. The mail order, again, available at that reduced rate, and you can see the additional benefits there kind of reflect the little bit of the higher copays as we discussed earlier. Out of network, again, you're going to be looking at that 20% coinsurance. Okay, this is the new plan for 2023 offered by Rochester 100. It's called the Signature Deductible 3. This plan is a high deductible health plan and will qualify for an HSA. We will talk about HSAs in a moment. So when you have a plan with a deductible, as you can see on this coverage, a single subscriber has a $1,500 deductible. A family has a $3,000 deductible. The deductible is your initial responsibility in terms of what you pay out of pocket towards the cost of that medical service before the health plan, which is Excelis, begins to share the cost with you. So for an example, when there is a deductible on a plan, let's say you went and visited your dermatologist. Your dermatologist will be contracted with Excelis at a fee for that particular service. That fee is lower than what you would pay without insurance. However, that fee is what you are responsible to pay towards the deductible. You'll get an explanation of benefits as you utilize your insurance and claims are processed, and you'll see those detailed on the EOBs. So you're responsible to meet your deductible first. After you meet your deductible, this particular plan works differently in that you see 20% after deductible. So all of your major medical services, hospital care, all of those are 20% coinsurance after your deductible. Now, I can't ever tell you what 20% of a certain fee is, but just note that it will be a percentage of the contracted rate. The nice thing about this plan, however, is the prescription drug coverage. As you can see, the prescription drug coverage is not subject to your deductible. Tier 1 is $10, Tier 2 is $35, and Tier 3 is $70. This is a nice benefit, especially if you have some expensive medications. Means that you do not have to pay out of pocket when you go to the pharmacy. You will immediately get those copays on all of your medications. Those additional services such as therapy, diabetic supplies, durable medical equipment, and routine eye exams all at that 20%. So again, this is a deductible plan. It's a high deductible health plan, and it will be your lowest cost plan of all three, because again, you're fronting up a little bit more money out of pocket initially, which keeps your premiums lower. So certainly this is a good option if you're healthy and potentially maybe want to think about setting up that HSA. Excelis, like many of the other health insurance carriers, does give you preventive care at no cost, meaning all of those preventive services are going to be 100% covered. Now, we just talked about a plan with a deductible. If you do go to your primary care doctor because you have an illness or an injury, that would be subject to your deductible, because that means that you are in need of a diagnostic treatment. If you're going to your primary care doctor because you're doing your annual well visit, that's different. You're symptom free. You would follow and be eligible for that preventive care schedule, which is going to be fully covered. Other things that are generally covered under preventive care are breast cancer screenings, colonoscopies when you're due, your vaccinations, your flu shots, etc. So remember that doing your preventive care is important. It helps avoid any diagnostic issues potentially in the future. And we do encourage you to do those things. Excelis does offer a $0 telemedicine benefit as well. Telemedicine, this particular benefit must be accessed through the vendor. The vendor is MD Live, so you would have to register through your smartphone, tablet, or computer. You must have a forward-facing camera. You do connect with board-certified physicians 24/7, 365 days of the year. In addition, there is behavioral health available to you as well. So therapists, psychiatrists, psychologists, these healthcare providers can treat a wide range of different, conditions. We certainly do remind you, to not use a telemedicine benefit if you're having an emergent issue. This would be for something potentially maybe when you're traveling for work, maybe you're on vacation, you need an appointment outside of work hours. It's just quick and easy to be connected with these healthcare providers. Besides treating, they will schedule and prescribe medications if you do need them. So this benefit, again, offered through MD Live, is certainly a valuable benefit for you to be aware of. We talked a little bit earlier about the mail order benefit. As we discussed earlier, there's a reduction in cost if you do choose to fill a 90-day prescription through the mail. It's 2 copays versus 3. This benefit's really nice for any kind of maintenance medications that you might have that you take all the time, daily. They just show up to your doorstep, every 90 days. And again, you get that reduced cost. Excelis uses 2 mail order providers. They use Wegmans and they use Express Scripts. So you can choose between one of those pharmacies. You can certainly, call them up or have your doctor send them electronically right over to those pharmacies. The medication will arrive generally within a couple weeks. Refills are processed, immediately. So again, this is a great benefit, especially for those maintenance medications that you take, all the time to get that reduced cost in your prescriptions. Blue 65 is Excelis's health and wellness discount program. The best way to learn more about this is to certainly go to blue365deals.com, get yourself registered. You really only need to show your Blue Cross, your Excelis Blue Cross Blue Shield medical card to get registered. And these discounts will apply to a bunch of different health and wellness, savings. You can purchase Fitbit devices at like 20% off. In addition, you get discounts on organic mail delivery services and so much more. So this is a benefit that is included with your Excelis plan. So certainly, go to that website, check it out to make sure you're taking advantage, of those things that will keep you healthy. Your Excelis medical plan, in addition, includes a 12-month premium subscription to the Calm app. You do have to go to your member account at member.excelisbcbs.com to get started. Calm is a digital experience to help you manage your stress, obtain better sleep, obtain mindfulness, and learn how to meditate. Certainly, the stress management program is a valuable resource. It does offer you 24/7 digital access to their library. And again, this is a benefit that is included with your Excelis medical plan. Hopefully, those of you who are already members with Excelis have set up your member account. You can either do that through the website or through their mobile app. I definitely encourage that you set up your secure account. You can get all types of information at your fingertips. It includes your coverage detail, your benefits. If you do have a deductible on your plan, it will track your deductible expenses. It will have your claims. You can get to the virtual health, MD Live, as well as some of the health and wellness tools that we spoke about before. Make sure you set up your member account so you have all of these resources, right at your fingertips. Okay, that's it for the medical. We're going to move into the dental coverage. The dental coverage is also offered through Excelis. The Excellus dental plan is called Dental Blue Options. Your preventive care, which includes cleanings, exams, your x-rays, those are covered at 100%. When you get into some of the basic restorative services, things such as fillings and simple extractions are covered at 80%. Other basic services fall into what they call Class 2A. These are things like oral surgery and endodontics. The only thing about these different basic services is there is a 12-month wait period. They are still covered at 80%, but there is a wait period. So certainly I would encourage you just to kind of consult your summary of benefits to make sure you understand these little minor nuances. Major services are covered at 50%. These are things such as, crowns, bridge work. The annual maximum, meaning that every member on your plan will receive up to $1,000 towards their dental care. The deductible will only apply to basic or major services. So it's a $50 deductible if you're an individual, or it's $150 if you're a family. And in addition, the plan does have some orthodonture coverage for your children. It is 50%. However, the annual lifetime maximum on orthodonture is $1,000. You're always best to certainly go and stay in network with your dentist. So certainly check the Excellus network to make sure your dentist does accept the plan and is in network. You can see there's no real difference in cost if you're in network or out of network, but what I will say, it's a bigger bang for your buck if you stay in network because those providers are contracted at lower fees. So it is always best to seek a in-network provider if you are able to. Okay, we're going to talk about HSAs, health savings account. The reason I want to make sure you do understand what a health savings account is, it's because you do now have a high deductible health plan offering. It's that signature deductible 3 plan. If you choose that plan, you are able to open an HSA and contribute to an HSA. Why would you open an HSA? Well, number one, an HSA is your financial account. Okay, it belongs to you. It's a savings account that you can tap into for medical, prescription, dental, and vision expenses. The benefit is the triple tax advantage. You will contribute this money to an HSA pre-tax. The money is going to continue to grow on a tax-free basis. And if you do withdraw, you are never taxed on this money. They are always paired with a high deductible health plan. Again, that's the signature deductible 3 plan. You have those out-of-pocket expenses attached to that plan. If you start this HSA and start growing this savings account, whether it's today or in the future, you're going to have money to pay for any of these upcoming medical, dental, vision, and prescription expenses. So each year the IRS will regulate how much money you can put into an HSA. In 2023, the maximum contribution for employee-only coverage is $3,850. If you are a family, it's $7,750. If you are 55 plus, you can contribute an additional catch-up contribution of $1,000. And just to reiterate once again some of the advantages of this HSA, remember, an HSA is your money. So it's very important to know that if you do change jobs in the future, or potentially if you are going to retire, this money will travel with you. It's portable. It belongs to you. So hypothetically, let's say you build up this HSA and you get to retirement age, and now you have all of these medical expenses that you certainly didn't anticipate having. Well, you built up that HSA and that money is there for you to use and draw from as you need it. So we like to tell people to think of it as, almost a retirement savings account. In addition, if you're extra healthy, it's a great way to put money aside for the future. And of course, we already talked about that triple tax advantage. So think about an HSA. You can set it up at a bank of your choice. We do always recommend KeyBank. They don't charge fees to set up HSAs, but this would be done by you, set up at a bank of your choice. And again, it does belong to you and will remain with you. In rounding out all of the benefits, your employer does pay for the New York State statutory short-term disability. Okay, should you be out for injury or related, illness, you will get a 170 maximum weekly benefit for 26 weeks. In addition, all employees who work 20 hours or more are eligible for the paid family leave benefit. We all contribute to paid family leave through our paycheck. The contribution percentage is listed on the slide. You can apply for paid family leave to provide care for a family member with a qualifying health condition, to bond with your newborn child or adoption, or to cope with a military leave event. So the additional benefit length is 12 weeks. The maximum weekly benefit amount for 2023 is $1,131.08. So this is the new paid family leave guidelines for 2023. And finally, if you are approaching retirement, Rochester 100 does offer their retirees a group Medicare Advantage plan through MVP. Just to be very clear, you must be retired from the organization, you must be 65, and in addition, you must be enrolled in Medicare Part A and Part B to be eligible to join this plan. If you decide this is the right option for you, the nice thing about these Medicare group plans is you can see there are no deductibles attached to these coverages. You can see you have some very nice low copays. A primary care office visit is $15. A specialist office visit is $30. The inpatient hospital stay is $250 copay per stay, but the benefit does max at a $750 maximum per year. Emergency room is $95, urgent care is $30, an ambulatory surgery procedure is also $30. The skilled nursing benefit is on there as well. Pharmacy under Medicare works differently in that you'll see a 5-tier program. Okay. Mail order is also available as well at that reduced rate. The copays are listed below. I would certainly encourage you to reach out to your employer for more additional information, on the Medicare group plan available, should you be approaching that retirement age and, thinking about this, as a continuation for your healthcare needs. Okay, as it pertains to the open enrollment period, we want to make sure that you are reviewing all of your current benefit elections. Okay, hopefully this presentation gives you some more detailed information, on what's available to you. Certainly you are allowed during this open enrollment period to make a change in that benefit election if you would like. I will say if you are not making any changes to your medical or your dental benefits, there is nothing you need to do. If you are making a change to your medical plan and or dental plan, okay, for the open enrollment window, you must have your enrollment forms back to Katie by December 14th, 2022. Please reach out to Katie for enrollment kit information. She can provide you with the proper paperwork. Just so you are aware, once you make these benefit elections, as we spoke about earlier, you will not be able to change them until the next open enrollment period unless you have a qualifying event. Okay. Again, your deadline for any new enrollment or plan changes is December 14th of 2022. Please make sure, again, you see Katie for additional information. And finally, I am your broker here at Walsh Duffield. My name is Amy. My contact information is here on the last slide. Certainly if there are questions that Katie and her HR team cannot answer, she can get them to me. I'm certainly able to help. We want you to, be informed and be mindful when it comes to your healthcare decisions. Happy holidays, and wishing you all, a wonderful 2023. Stay safe and be well.